I'm Angelique Martis-Ramon, and welcome to A Better Place, the place where families are created, nurtured, and eventually blossom. It's an educating, enlightening, and motivating new television program with the goal of educating adults, parents, as well as their children on topics related to family life. The word Betta is the acronym for babies, infants, toddlers, teenagers, and adolescents. The program aims to create a better place by educating and empowering families. The commencement of this program will be a 13-part series that will be televised once a week with a repeat telecast within the same week. Some of the topics that will be dealt with in the 13-part series are pre-pregnancy, prenatal care, delivery, postpartum, infants and parents, toddlers and family, and the early preschool days. Today's program will be dealing with pre-pregnancy and how persons should prepare for pregnancy. Our guest for today is Dr. Sonia Swanston-Mead.
Are you ready to jump?
Yeah, I've got the very pretty insurances parachute.
Is that a good quality parachute?
I don't know, but all the things they told me about it sounded very pretty.
Well, okay then. Let's do this.
Hey, 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 hey,
Gotcha! Hey, I've got you, man. Relax. I've got you.
I gotta get myself one of those Henderson Insurances parachutes.
The right coverage when you need it.
Who wants the same nail color day after day?
Not me.
New Revlon Top Speed Nail Enamel. Cool color with a built-in top coat that sets in just 60 seconds.
With Revlon, you can change your mind again and again and again.
New Revlon Top Speed Nail Enamel.
A good party, a splash of red wine, a lingering memory. So we invented our Scotch-Brite Easy Erasing Pad that cleans surfaces, and with a flip, the white polymeric foam erases ingrain stains forever. Scotch-Brite, smart, simple, and clean.
Hello and welcome to A Better Place, where our guest today is Dr. Sonia Swanston-Mead. Welcome.
Thank you for having me, Angelique.
During this program, we want to talk about the couple who is planning a pregnancy and what would you consider to be the appropriate health of a person or persons planning to become pregnant?
First of all, that couple needs to seek health care. I think lots of young people feel that they're healthy, and indeed they ought to feel that way because they should be healthy, and actually may not seek health care at all until the event of the pregnancy. If that couple is really planning for a pregnancy and they're doing it as a conscious act, then they may want to seek some sort of health care, some sort of health checkup to find out if they're healthy. And that would involve a visit to a doctor's office to ask for a general health checkup. There wouldn't need to be any sort of specific checks at that particular point in time for fertility, but just to know whether one is healthy and that there are no illnesses or nothing in the background that could become an illness or could become a problem if the couple got pregnant.
Well, Dr. Swanston-Mead, since our topic for today is prenatal care, can you explain to the viewers what prenatal care is and why it is so important?
Okay, so the word prenatal actually is almost self-explanatory if one understands what the word natal means. Natal actually is a synonym for birth, so pre-birth, and prenatal care is the care of the pregnant woman during the months up until her delivery of her baby. It is important because over the years we've come to realize that we can detect and prevent certain conditions which can be harmful to both the mother and to the child. And so at the initial visit, when a woman first discovers that she's pregnant, usually the doctor, if the doctor doesn't know that patient very well, should really do a sort of a full health screen to make sure that there are no underlying or previously existing conditions, such as high blood pressure and diabetes, just for an example. Those two are very common in our society, so those two are screened for. But generally, during the antenatal checkups, which is another term for prenatal, we are going to be monitoring the patient's weight. We like to have a look at the urine to make sure that there's no spillage of sugar or protein into the urine. There is the blood pressure measurement, which is always done. Blood pressure is very important in pregnancy. We know that sometimes high blood pressure can complicate a normal pregnancy that appears to be normal, but then at the end of the pregnancy, the blood pressure rises and can pose a threat to the life of the baby and indeed the life of the mother. So blood pressure measurements are very important. And actually, it's sometimes good to have the blood pressure measurement done before pregnancy.
Right.
So that we have an idea
So
what...
that was the question basically
Okay.
I wanted to get at. So prenatal is the patient is
Who is
already
pregnant? Yes, that's right, yes.
Okay, so then what about before pregnancy? How
Okay.
important is it before the patient knows or actually the patient is trying to conceive?
become pregnant, okay.
How important is it for her to be taking care of herself? Are there anything she should be doing specifically?
Okay. Well, the decision to become pregnant or to have a child is something which should be a conscious decision. First of all, I should like to emphasize that. We would dearly like for pregnancies to be planned, and therefore, if one is contemplating childbearing, one should try to ensure that that happens when one is ready. And so, as I've discussed in the past, and I've spoken to you about this before, Angelique, planning a pregnancy is important, and therefore not having an unplanned pregnancy is also important. So I think in the pre-pregnancy days, a couple, and it's not just the female, a couple should decide how best to prevent an unwanted pregnancy, and so they need to make particular choices about birth control. Having done that, and they've decided that now it's time because they are ready, you know, in various ways to have a child, then it's important for the individuals, both the male and the female, because they should both be healthy, to check and to have screening tests done by their family physician to make sure that they are well enough to have a child. For young women, you know, who are in their early to mid-20s, we don't expect that there's going to be a lot of illness. But that depends on the person's family history. It depends on their own socioeconomic background and their own cultural background. We know that nowadays overweight and obesity can be a factor, can be a problem. In fact, it can sometimes prevent women from becoming pregnant when they would like to become pregnant. So weight management is something that is important. And somebody who is not overweight will have an easier time with a pregnancy. It doesn't mean that all overweight women are going to have complicated pregnancies, so don't get me wrong on that. But weight is an important factor. And if we're going to be looking at weight, then it means that diet and exercise are also important to that person's health. As far as diet is concerned, we know that there are certain food groups that are healthy and that are nutritious and that are good, and it does not include fast foods. I think everybody knows that. I think everybody knows which foods are nutritious and healthy. We all know that it's good to eat fruits. We know that it's good to eat vegetables. We know that we shouldn't eat too much fatty foods. If we are going to be eating, if we are meat eating persons, we should try to eat meat that is low in fat and remove the skin from chicken and so on. So the diet per se is something which is well recognized in terms of what is healthy to eat and what is not healthy to eat.